this. Neil Greenberg is joining me now from Portsmouth in the United Kingdom. He is a clinical and academic psychiatrist at King's College. Neil, thanks very much for joining us. Well, your reaction then to the findings from this study, at least, that the evidence for harm is on balance more speculative than conclusive?
Yeah, I don't think it's actually overly surprising. I mean, the key thing is that you can definitely have a very tough time on any form of social media. And we know there's plenty of examples of people who feel that they have been unfairly treated and they've been trolled and they've had lots of unpleasant comments made about them. And that absolutely is detrimental to someone's mental health. But those sort of things can happen in real life too. They happen in workplaces, they happen in social settings, they happen in schools. And I think what this study is showing is it's not really down to whether one looks at social media or real life settings that makes the difference. It's what the content is. That's what makes the difference. And I think one of the useful things about this study is it also points out that actually there are positive impacts of using social messaging and social media sites. Many people can be very supportive and they can be very helpful. And when people are having difficult times in their personal life, then actually their friendship groups and their networks on social media can be there for them to support their mental health. So we really shouldn't see social media as being a bad thing in itself. It's how it's used.
Yeah, I mean, some of those findings disputed, though, by the Facebook whistleblower Frances Haugen, who pointed out that this study isn't well designed to access the actual impact of Facebook. She says that the 13 to 35 age group isn't useful for studying children's well-being, and user data did not identify the heaviest users of social media who often suffered the biggest problems. Clearly, there are difficulties in trying to survey this to find proper conclusions, despite the size of this survey.
Absolutely, and actually having read the paper, it actually makes very clear that there are limitations, and it makes the point that this is an international study and some countries may well be affected different to other countries as well, and I'm sure the same goes with different age groups and adults versus children. But I think what we generally hear said is that social media is a bad thing. It has terrible effects. It can ruin mental health. And, that's people's opinions. This is the first, I'm sure, of what will be many studies, which at the moment is not necessarily supporting these negative findings. All research has limitations, and this is a really good study from the University of Oxford. And I think that our team at King's College London are very interested in this finding, because I think the key message here is we need to do more research. Academic researchers always say that, but we shouldn't just jump to the conclusion that something's new, like social media, well, not that new now, and that is necessarily bad. I think we need more evidence, and just because a campaigner has put their point of view forward, it doesn't also mean that that point of view is correct.
Neil, we thank you very much, as always, for coming on the NewsHour. Nice to speak to you.
Thank you very much.